So I started the recording, everybody.
Oh, shoot.
Okay. Okay. Can people see my screen? Can people see my screen? Yeah. Okay. And I'm not going to do the full PowerPoint because what, like, the way PowerPoint is, it just ruins my thingy. 3 screens. So I'm just going to keep it at this 1 screen. So this is our agenda. We have Carrie Wuda to talk about day treatment because somebody asked, what is the process to getting day treatment sites licensed and so forth? And then hopefully Carrie will be here. She said that she could be here and so forth. And then next we have OD updates and other updates, including Q&A for other sites, opportunity for sites to ask other sites questions, and a really short overview of the Family First Act PowerPoint by Andy Tack, which they did a couple of months ago, and some of you participated in. And that's it. And then the PowerPoint I will send out, which has, which has other past recordings. So first off, good, people are still coming in. This was shared last year at our last May meeting, but then I wanted to share this out again. So these are our important dates. Our dates of meeting dates are, the next meeting is November 5th, 9 a.m., February 4th, 9 a.m., again Friday, and May 13th, 9 a.m. I try to keep it consistent at 9 a.m. on Fridays. So those are the dates. And of course, the PowerPoint presentation will be emailed out later. And also, these are the dates for the child count. Ooh, so if you're not muted, please mute yourself. I'm going to mute everybody, okay? Okay. So hopefully people can still hear me. I muted everybody to eliminate background noise, but I'll unmute all when when asked for people. So these are the 6 important dates for child count for Title 1D. And remember that the count is from January 1 through December 31st. So please keep a count of the number of kids enrolled, not in attendance, but enrolled on these child count dates. Okay. I don't see Carrie here. Okay, so hopefully she'll join on. If not, it's okay. So next, OD updates. Oh, are there any questions on the important dates? There shouldn't be, but if yeah, and then I will. Yeah, and if you want to, you have the ability to unmute yourself. So feel free to unmute yourself if you have any questions. Okay, OD updates. I think the last one I received on Wednesday. Yes, yeah, it was Wednesday. 100% of the sites have submitted their 8th quarter invoices and their 1921 monitoring tool, which is yay! I can start paying everybody, which is really good. And then we have about yeah, it actually should be about 5 million that's unclaimed. Okay, so we have that. Next, some people are asking, when are we going to have the contracts out? As I did the screenshot, I just received our thingy on this Thursday at 5:44 p.m. for our agreement. So they want me to provide my feedback on DOJ's feedback, and I'll do that first thing this after our webinar. So that'll be my highest priority. So the delay is not with us; it's with others. I submitted my stuff like in March and so forth. So hopefully the agreements will be out with our contract amounts shortly. Perhaps, I hate to say this, early November, late October. Sorry, it is what it is. I know it's causing, and I did ask, oh, somebody asked, will any of this meeting cover when and if LTCT will expand number of host sites? Yes, there is a section here that I would talk about that. Yes. Somebody asked in direct chat, and then some people, they don't want to speak out loud or chat. I know sometimes they would email me or text me, so you can do that also. So so sorry for I did ask our people whether we can, if like LBL ESD, if because you guys have a large site, a children's farm home, if you can invoice us for the first quarter even without a agreement in place. I asked that, and then we'll see. I haven't got the response because payroll and cash flow can become an issue for some sites, especially like like PPS has 7 sites now, right, Max? You guys have 7 sites, yeah. Now down from 10. Yes. Yeah, so that it can become a cash flow issue. Yes. So I will try. Yeah, I asked that, and we'll see. Okay, so yep. Next, okay, so 2 main LTCT data collections are coming up in November, which I will cover more in depth on November 5th at the November 5th LTCT meeting, because that is when we normally get, I get a lot of questions and so forth. And that will be on the CSPR, Consolidated State Performance Report. That's a spreadsheet that we submit that asks for the number of kids by age, demographic, race, ethnicity, and so forth. And also your academic outcome data like reading and math scores, credits and diplomas, and so forth. And Title I decount data, that is the second one. And then as I talked about earlier, I'm gonna collect the counts on all 6 data, on 6 states. And then once I have the date with the highest count, then that'll be the date for our child count date. Then after that, I have to ask for their names and the SSIDs because they cannot be counted on both subpart 1 and subpart 2. As you know, some of our kids go in between from facilities, and it's just that students can be only claimed at one facility, and LTCT gets priority. YSEP and LTCT gets priority over subpart 2. Next, on-site and desk monitoring tool for 21-23. I don't envision the tool being different, but it is my every intention to have on-site monitoring for 21-23. For, of course, obviously for 1921, I didn't, neither Adam nor I got out to your sites, but next year, I'm hoping 22-23 will be able to travel again. And if not, we would go back to desk monitoring. And the LTCT service plan template is forthcoming, hopefully next week or the following week. I know some of you have asked for it already. It'll be due in October or November. Okay, so does anyone have any questions? Anyone have any questions? Okay, next. Okay, now, and then later on, I'll be asking, I'm asking feedback and selection. Feel free to chat or send me an email later on and so forth. 2 things that I'm working on well, I'm working on other stuff, believe me, but these are 2 things related to LTCT. One is our LTCT webpage is really outdated and really, really old. So later on, email me or send me whatever. What do you want to see on OD's LTCT webpage, on OD's YSEP webpage? What do you want to see on JDEP's webpage? Let me know what do you want on that and so forth. Because our OD web pages for our programs are really outdated. I haven't updated them for ages. So we're going to revamp it. So what would be helpful for you as an LTCT site or provider, and so forth? So send me an email, ask me what would be helpful. Next. Oh, and the thing about it is too, like, if you want me to post documents and so forth, that if that is a little bit more painstaking because it has to be, because it's on our OD webpage, it has to be vetted, has to be in an accessible format and so forth. And yeah, so if you want documents, it'll be a lot. It's the review process is it'll take longer, but other things I can post. But let me know what you want to see on OD's web pages and our education program web pages. Next, the application for new LTCT sites. In the 1921 biennia, we didn't our policy opposite package and thingy didn't pass, but we're not giving up. We may just go with it in 22-23. So what I'm working on right now is a white paper on the Christie's list of why we should eliminate it, why we should open it up. Obviously, you know, the inequities of it and so forth, but I need to, I've been asked to write a white paper as to why the Christie's list, which is now, you know, why it should be eliminated and so forth. And here's this. One fact is, when I took over LTCT, I think like in 2015 or whatever, we had 47 sites. Now I believe we're down to like 36. Just last year, just in from the 2021 year, we lost 5 LTCT sites. We lost Boys and Girls Aid, John's Landing from PPS. We lost Therapeutic Learning Center, which is in Douglas County with Douglas ESD. We lost 2 sites in Josephine County in Grants Pass, which is Kairos, New Beginnings East and New Beginnings West. And we also lost Salem Kaiser's program in program school. So just in 1 year, we lost 5 programs off of our list. So that provides an opportunity to increase our roster to add new programs. And that's just reality, you know, that's facts. And but then here's this too. We do have some LTCT sites that are increasing their classroom sizes because of demand and so forth. Like, and then the largest one this past year was LifeWorks, which is run by Northwest Regional ESD. They went from 1 classroom to 5 classrooms. So because they started to include all of their day treatment centers. So if any of you have, you know, like want to have input or help me, like give me ideas of why the Christie's list should be eliminated and why we should have, you know, open it up for new programs, send me an email or feel free to give me a call and so forth. And then here, my phone number is here, 503-931-4103. Feel free to call my cell phone. I'm not in the office. If I can, I will answer. If not, I'll try to leave me a message and I'll try to return the phone call. So don't be afraid of calling my cell phone. It's an ODE cell phone. Any thoughts or any comments on so far on this? Feel free to unmute yourself. No thoughts, no comments? Okay. Okay, next, the Menstrual Dignity Act, House Bill 3294. To be honest, of all the bills that were passed, oh, and here's this. A legislative win for our unit was, as Toby from and Math knows, so because we have some JDEP people here, JDEP funding went increased by 75%. So it can be done. So hopefully if we have new programs, we can ask the legislature for additional funding. JADA went increased their funding tremendously. So we can. So of all the acts that were passed this past year, the Menstrual Dignity Act, that's the one act that I got a lot of questions and emails about. And then for those of you that don't know about it, it's here. Can you see, can everyone see it? Okay, so here, so basically it was, it's House Bill 3294, it was passed, related to female hygiene products in public schools, creating new provisions, amending, so and so. So the definition of education provider, school district or EST, obviously, right? Now here's this, C. Student bathroom means a bathroom that is accessible by students, including a gender neutral bathroom, a bathroom designated for females, and a bathroom designated for males. So here each public education provider shall ensure that both tampons and sanitary pads are available at no cost to students to dispensers located each in at least 2 student bathrooms of every public school building. So some of the questions that I received was, Sam, my program is all males. Do we still need to do it? Student bathroom means designated for males. Questions were asked, do I have to provide it or do the residential program have to provide it? I would say if I'm sure, like if the residential program has females, they should also provide it, but also just to be safe, according to the law, education providers should also have it there too. Even in public safety, like at JADA, just in case if the JADA facility doesn't have it, it says a school district, right? It's supposed to have it in there. Any thoughts or comments? And this bill came with funding, so your school district and ESD received funding for it, and so forth. So, yeah. Yep. Is this news to some people? Thoughts? You can unmute yourselves. Thoughts, comments?
Sam, this is Candace at the Child Center. Is there any stipulation? I don't see anything about age. So we have bathrooms that are, K2 and the bathrooms that are middle, older kids. So I'm just not seeing if it includes LTCTs as well.
You're correct. Yeah, age didn't come up. But then I would think for your site, the Child Center, the sites, the bathrooms that the older kids utilize, you should have, yes, for your day treatment and your residential, yes.
So then that funding went to the district and we have to apply to the district for the funding?
Yes, but then here's this, Candace. You can use your ODE LTCT funding too, out of your funding, to purchase these things. Yeah.
Okay, thank you.
Yeah, it's not like, yeah, it's an org, and then someone asked, can we use Title 1D? No, I wouldn't use ID or Title 1D. This is an Oregon thingy, so I use Oregon funds for it. Remember, this is for the dignity of students, of female students. So even if you have an all-guy facility, it is what it is. It says here, a bathroom designated for males. Any other thoughts or questions? And I kid you not, this was the one bill that I got a lot of questions and answers and emails on from after the session. Okay. For those of you that are new to LTCT, send me an email or phone call to schedule an orientation for new LTCT administrators. I have like a short presentation or thingy that I can go over with you, but it's really for those that are new, because we do have some that are new to the LTCT world. So yep, feel free to contact me to schedule an orientation. Yep. And other agenda items. Now there's an opportunity for people to ask other sites questions and so forth. And some of the things, as I talked with others, one was counts. Some people are saying their counts are low. And here, I have no intention of changing the 21-22 allocations, you know, but if an opportunity arises where a staff member leaves or whatnot, and your counts are low, feel free to, you know, make adjustments, because in February, that's when the minimum staffing data is due for the upcoming year. And remember, if you have unspent 21-22 amounts, you can carry that over to 22-23, but you cannot carry 22-23 money into the next biennial. So you can, like, if you have unspent year one, you can carry that over into year two. That can help offset some of the planned losses for next year, if there's any. And some people are talking about staffing issues. So now I'm gonna kind of be quiet, and for other sites, feel free to ask other sites your questions, because this is an agenda item others have asked for. So I'm going to be quiet and let others speak. And ask questions.
Hey, Sam, this is Toby. Can you hear me?
Yes, Toby, I can hear you.
Yeah, hi, thanks. And thanks for inviting me to this group. This is new to me, Sam, so I'll probably schedule an orientation with you. But just in general terms, I saw the date of October 20th. Are you going to be sending an email on October 20th for that count? And we just simply give you the raw number of students that we have enrolled? Or is there more to it than that? I guess I'm just trying to be prepared for that October 20th date.
Okay, that's a good question. And then, okay, so what it is Toby, for Title I Day, everybody, there's Title I Subpart 1, and there's Title I D Subpart 2. For Subpart 2, it is the October caseload count, where any site can select a 30-day period but then at least one day has to be in the month of October. For instance, like a site could pick October 20th, and then the 30-day window could be from October 20th to November 19th or so forth, or from November 20th to September 19th. So Subpart 2, the Title I D count is a 30-day window where at least one day has to be in October, where they can pick their highest 30-day count dates. But for Subpart 1, the program can select any date from January 1 through December 31st. For YSEP, for Youth Corrections, because YSEP has a centralized student information system, we do it electronically. We go through and we select the date, and we can pull it out easily. But then for long-term care and treatment, because everyone has their own student information system and we don't have a centralized system, these are the 6 dates that you have to keep the track on, Toby, you know, like the number. And then I'm going to send a spreadsheet out in November asking you, on October 28th, how many kids did you have? On May 12th, how many kids did you have? On May 19th, how many kids did you have? And then from the 37 sites, I will compile all the submissions onto a giant spreadsheet and tabulate it. And then generally it might be April 28th, it may be May 19, who knows. From that date, then I will communicate to everybody, May 12th is the date that was selected because that is the date that has the highest count. So now I need your student information, your student ID and the names. When you submit the counts for these 6 dates, Toby, you don't have to submit the students' names. It's afterwards. And I need the student's name and SSID so that they're not counted on another site's count. LTCT and YSEP gets priority. Yep, that's the way the federal law is written. Does that answer your question?
Yes, thank you so much for the clarity. Appreciate it.
Sure, sure. Any other questions? No, that's a very good question. That is a very good question. Any other questions? And any other questions for other sites? This is an opportunity for people to share or people to ask each other.
Sam, this is Candace. I think like the whole state, we're struggling with getting new teachers when we have a teacher leave. And I understand the districts still have open positions they haven't filled. I was told by somebody that the districts are using some kind of alternative pathways for teachers, for instance, teachers that maybe need one more class or who have finished but haven't applied yet for their TCSP license. Are you hearing of any alternative pathways for teachers to fill spots that are being left open or that administrators are having to fill?
Candace, I'm gonna let, I did hear and I did have conversations with some sites, but I'm gonna let others talk, and share their experiences.
Okay, thank you.
And then after that, I'll share.
Hey, Sam, this is Lisa Bates at Levi Anderson Learning Center. And I would just say that we've had a difficult time replacing teachers that retired. So we are working with TSPC with a teacher that's on a restricted license. And again, I think the shortage is, again, across the state. So we're doing that currently.
Thank you, Lisa. Others? Oh, and Krista shared from Forest Grove. We have bachelor's level support, get emergency license or restricted sub licenses with TSPC. Thank you, Krista. Others?
Sam, this is Toby again. I'll just kind of reinforce that down here in Klamath Falls, we are also having a teacher shortage. And even more so than that, we're having a difficult time with parapros. So in our program, we're down 2 parapros, and I have those jobs posted with no applicants. Unfortunately, our district pays so little for parapros. At this point, it's actually, you would actually make more money going to many of the fast food restaurants. So it's a tough sell at times. I'm sure you guys feel that too, with both certified and classified staff.
Thank you, Toby. Others? And then when I talk with others, someone asked, what is the contract requirement? And the contract requirement is they have to be licensed, for LTCT, because what we didn't, and that was intentionally put in because of the fact that we didn't want our JDEP, YSEP, and LTCT sites to not have fully licensed teachers educating our students, because we didn't want our students to be considered like second class, students and so forth. So that was one of the requirements of our contracts that was intentionally inserted into the contract. So, but then you do what you have to do and what you're able to do, right? So, but then our contract does state that our teachers that are funded with Oregon State School Fund dollars and Title I-D need to be, fully licensed teachers. And I know some, like one school district was or it was an ESD. They got teachers from California and so forth. But yeah, we recognize that it is. Yep. And then Maddie shared that many of the regional schools have you know, restrictive teaching licenses this year. There is a tremendous shortage. Yeah. And I'm gonna, the elephant in the room is COVID vaccination. You know, that's the thing, you know. I didn't want to bring it up, but I guess that is one of the things. That, and then people not wanting to get infected, not wanting to work and so forth. Yeah. Oh, and then if you didn't know, Oregon Department of Ed and other state agencies, our tentative date of reopening is now January 1st. Our tentative reopening date was supposed to be September 1st, but it now has been officially been announced. Our tentative reopening date is January 1st, where ODE will be back in the office. But right now we're still in, you know, still working from home, as I'm still working from home. But here's this: if you want me to come out, or if there's a meeting where and so forth, like an in-person meeting, feel free to send me an email or whatnot. Because although we're not in the office, I think our travel restrictions have been. I know it. Wait, I do know our travel restrictions have been lifted. So yeah, so yeah, so we can travel again, but yeah, but we will not be in the office. So how about your counts? Are all of your counts kind of low? And don't worry, like I said, like I have it on the PowerPoint, there's no intention to change, to decrease the 21-22 allocations. Are your counts low, everybody?
And this is Candace. I think our counts are low because of COVID. And then now we're looking at the SB 710 issue of who we can bring in, and quite a few of the kids on our wait list, you know, now are too high needs to serve at this point. So I know that on the mental health side with Carrie Wood and OHA, our staff are meeting and working on some ways that we can help alleviate some of the long wait lists for those kids and what alternatives are. But that on top of COVID has caused quite a bit of slowdown in the amount of kids we can hold.
Okay, and I was reading the chat, and as Krista shared, people can see in the chat, you know, yes, counts are low, residential beds are empty, and wait lists can't be filled due to staffing crises. Max from PPS shared their counts are low. Yep, struggling with staffing, and Trillium had to hire temporary surge from all over the country. And Kathy, do you want to talk about that too? Because you also have Trillium.
Yeah, our census, I think Trillium shared, I'm from the Corvallis Children's Farm Home. They've shared, I think their census is like as low as it's ever been. They're really struggling to find skills trainers. With the pandemic and COVID, it's just been tough. But OSU is back. So the hope is that they can have a surge there because they get a lot from Oregon State students. But it has been tough. They've just gotten a whole host of CNAs that have come to kind of help relieve. But yeah, it's been tough with both residential and day treatment.
Thank you, Kathy. And then here on the screen, can you guys see I posted the statute for funding for LTCT? And the reason why, even though your counts are low, we don't need to change 21-22 funding is because here, the way we get our funding from the state school fund is for day and residential treatment, the net operating expense, it's not state school fund. That is the NOE amount for school districts, and it's the number of slots available for all students. It's not the actual number of kids in those slots. So LTCT, we get our funding based on capacity. So like, let's say, suppose like Children's Farm Home, you had a capacity of 64 slots. Even if you have 32 kids, we would still get funded at 64 because you have the capacity to serve 64 kids. So that is where we have a benefit of, we're not based on state school fund by total, like actual ADM. You know, we're based on the statute clearly states number of slots available for all students in eligible day and residential program. So, but then in February, I will be asking again in your count for your slots and the number of kids, because the minimum staffing level does come into play for the number of teachers and so forth. Yeah. So this is how we get our funding for our LTCT program. And up here is the funding for hospitals and so forth. Any questions? Okay, so other thoughts. And then Candace, you shared that Senate bill. Do you want the number? But if you want to share the impact and what the title of that Senate bill.
710, Senate Bill 710, which has to do with the restraints and seclusion mandates now.
And do you want to speak about how that is impacting your operations at your site?
Well,
because it's happening at other sites too. I've heard it from other sites too.
I think for us, what it, for the last couple of years, because residential beds have been shrinking in the state, and kids still have high needs, we've been serving kids that are kind of borderline residential, but doing our best to at least help them. And what we're seeing now with SB 710, if you're not able to do other than a sitting restraint, unless it's a really highly unusual kind of breakthrough case that you didn't expect it. But if you know kids coming in are going to need more hands-on and more of that type of the prone restraints for safety issues for themselves and others, you can't do that any longer without just a whole lot of reporting and avoidance. So what that did was it made us have to revisit our wait list and work with the mental health department and kind of weed through the kids that we see that are more like internalizing issues. So they're depressed, they're suicidal, they're not the acting out overt kind of issues that you see. So we're doing more kind of that trauma-based, like again, internalized issues. So what it's done is it's just made it so we already were taking less kids because of COVID, and we were just ready to start bringing in more kids and go back to a full classroom site when the SB 710 came out. So we think we're going to be all right. We think we can still maintain the kids. We've done a lot of training around that. We're revamping. We're waiting to hear the final training program that will be used. But in the meantime, we use PROACT, and we're revamping some of that from the viewpoint of how you work with kids that might have higher staffing issues. But we are concerned that the wait list of the kids that we've had to say we can't serve, and the schools can't serve them, and there are no residential beds available, where are these kids going to be? They're going to be on home instruction, and it's not the best. So we're still trying to work out maybe some alternative programs, whether it's CDL or telehealth, or we're just in that kind of fact-finding, brainstorming, trying to figure out how to serve the kids. But it definitely has made us take a look at who we serve, what the purpose is, the length of stay, and all of that in trying to work around this new bill. And I know it's the same for everybody. I don't attend that meeting that the mental health side goes to, but I know that there are a lot of discussions and questions and brainstorming is going on in those as well.
And as Candice mentioned, I was talking to one school district, and the school district was venting their frustration, saying like the day treatment site were not accepting the higher end kids. So, and then so they're placing their kids, as Candice mentioned, and homebound instruction. And I kind of went, ooh, you know, that kind of stuff. So that is some of the things that are happening. Others want to share or want to ask others questions? Okay, if not, I'm gonna go and to the next thingy. I know a lot of our providers, agency providers, are aware of the federal Family First Prevention Services Act, but then it might be new to some of our educators. And so this is, you know, NDTACT is our technical assistance provider for LTCT and YSEP, and also for Subpart 2. And they did a PowerPoint um, on you know, the child welfare and so forth. Like I don't need to go through this part because a lot of you and then this will be emailed out too. You know, and oh, and I think Candice, you participated in that webinar too, right? Did anyone else participate in that webinar? Um, so I know some of you are intently looking at the stats. About the placement. So basically what we got out of it was with the new federal act, they want to keep the kids with their families. They want to try to reduce the out-of-home placements as much as possible. So here, so the one of the questions that we asked were, if the federal law and, you know, reimbursements for out-of-home placements are reduced, will counts go down and so forth? Yes, they said yes, but it shouldn't have that much of an impact. So they are trying to reduce the placement of kids in residential. Yeah, that's the main thing I've got out of the yep. And here, you kind of don't want to see this like when funds are more restricted on the use on what you can use your funds for and so forth. Yep. Oh, darn. Yep. How our Title I intersect. I remember delinquent is like our YSEP Youth Corrections OI facility, neglected are our LTCT. So this is how it intersects. Yep. So so basically here to talk about, so basically the message is some of you at residential sites are seeing low case counts. I anticipate it to continue and so forth because of the fact that, you know, the federal government and perhaps Oregon want to keep children and families together, yep, instead of out of placements. And any thoughts or comments on that? Feel free to any thoughts or comments? And I'm going to share YSEP and JDEP's count on the 3-year, which is good. On the grand scheme of things, it's good that YSEP is down, JDEP is down on the placements because we want less kids incarcerated. But as you know, one of our feeder sites of LTCT is YSEP and JDEP, you know, from OIA kids and so forth. So their counts are down over a 3-year period. Yeah. So and then we track it over here is our I didn't put in the 2021. So JDEP in 0809 we're at 237 down to like 129, probably in the 90, and then from YSEP 707 to 313, which is good. You know, we want less kids incarcerated, right? So our counts have been going down. Yep. And then here, yep, I have to put in, and then that's the thing with COVID, and it's like, oh, ruins our data. Okay. Any agenda items? Any other questions or comments?
Sam, can you just mention too, we had talked about the ESSER 3 funds and whether those were going to be available to LTCTs. Have you heard anything on that yet?
I have not. Okay, so let me talk about the ESSER funds. Yes, thank you, Candice. So the way we get our ESSER funds is from the state set aside. It is not where, like for school districts, they get a set amount. You know, as part of the law, they get amount. But for us, regionals, ESDs, and so forth, it is taken off the state set aside funds, where the governor and ODE and so forth, they get to decide how they want to spend their money. The state is set aside. So I have not heard, I haven't gotten an update on the direction they want to go with the state set aside. For ESSER 1, it was very minimal, and to the point where, you know, and it was just given to the school districts and ESDs with the allocation of JDEP, YSEP, and LTCT built in. But ESSER 2, it was a larger amount, so it came through our unit. We don't know the amount. We don't even know if we will get some of the status set aside for ESSER 3 funds, how much or whatnot. Yeah, I have not heard. That's a good question, but I'm hopeful. I'm hopeful that we will. Any other questions or comments? And the November 5th meeting will be, a large part of it will be talking about the data collection. So feel free to invite your data people to come. But then for those that have done it in the years past, you know, it's the same thing and so forth. Any other thoughts or comments? So if you have any thoughts on here, on what do you want to see on ODE's LTCT and JDEP, YSEP web pages, send me an email or feel free to send me an email on what do you think should be included in the white paper to eliminate the crises list or to allow new programs to apply and so forth. I'm not giving up on that. I still want to, because it's an equity thing and so forth. And I don't want to say which school district, where it's going to be or who, but we did get wind of a new residential facility that will have 10 classrooms. That's huge for a new residential facility to have 10 classrooms. They're taking over a shuttered facility. So that is going to be huge. And I had conversations with that school district and they're saying there's no way that they could fund teachers for 10 classrooms without ODE support. That would be a huge burden on any school district, right, Max? Even for PPS, right? If a new residential program of 10 classrooms were to be open, it would be a drain even on PPS, right? Yeah. And I'm not going to say where or whatever, but I've had conversations with both the provider and that school district. And the school district said, if it does open up for 10 classrooms, they will be seeking OD assistance because there's no way they could absorb 10 classrooms. That's kind of like a small elementary school. Yeah. So, thank you, everybody. If there's no further questions or comments, I'm going to stop the recording, and I will stop recording.